What is pathology's role in diagnosing testicular cancer types? Imagine trying to solve a complex puzzle where every piece is tiny but crucial. That's what pathologists do when diagnosing testicular cancer. After a doctor suspects cancer based on physical exams, blood tests for tumor markers like alpha-fetoprotein, human chorionic gonadotropin, and lactate dehydrogenase, and imaging scans such as ultrasound. The next step is often surgery to remove the affected testicle. This procedure is called an orchiectomy. But the real key to understanding what type of cancer it is comes from examining the tissue under a microscope. Pathology is the science of studying tissues and cells to identify disease. When the testicle is removed, a pathologist carefully slices the tissue into very thin sections, stains them with special dyes, and looks at them through a microscope. This detailed examination reveals the microscopic features of the tumor cells. For testicular cancer, the main types are germ cell tumors, which include seminomas and nonseminomatous germ cell tumors, and less common non-germ cell tumors. Differentiating between these types is vital because they respond differently to treatment and have different outlooks. Pathologists look for specific features in the cells, such as their shape, size, and arrangement. They also check for subtle signs like intratubular germ cell neoplasia, which can be a precursor to invasive cancer. Sometimes, distinguishing between seminomas and nonseminomatous tumors can be tricky, especially if the tissue shows mixed features. In such cases, pathologists use additional techniques called immunohistochemical staining. This involves applying antibodies that attach to specific proteins found only in certain tumor types, helping to clarify the diagnosis. While blood tests for tumor markers provide helpful clues about the presence and extent of disease, they cannot definitively identify the cancer type. For example, elevated alpha-fetoprotein suggests nonseminomatous tumors, but tissue analysis is needed for confirmation. In some rare cases, especially when the cancer has spread extensively and tumor markers are high, treatment may start before the tissue diagnosis. However, the final and most accurate classification relies on the microscopic examination performed by a pathologist. In essence, pathology acts as the gold standard in diagnosing testicular cancer. It confirms whether cancer is present, pinpoints the exact type, and guides doctors in choosing the best treatment options. Without this detailed tissue analysis, it would be impossible to accurately determine the nature of the tumor and predict the patient's outlook. For anyone facing a diagnosis, understanding that pathology provides this critical, definitive information underscores its vital role in managing reproductive cancers. Always remember, personalized medical advice from healthcare professionals remains essential in every step of diagnosis and treatment.